You can use the clinical at your clinical practice the grading scale for the contact lens complications, and the Efron grading scale are of the 16 contact lens complications, but uh, we for the screening for the dry eye disease are using this scale to evaluate the three most important structure changes as conjunctival redness, corneal staining, and conjunctival staining. And the general interpretation of each grading step is shown in the table below. And although this is only guidelines what you can use, and of course it's not intended to replace professional judgment. If your patient are still complain about the ocular discomfort even with the first trace grade, and you see that the changes are very small, but still they are, maybe it's the sign of the dry eye. And this is how the full Efron scale looks like. And what I'm pretty sure most of you have seen this, and actually also are using this grading scale and to evaluate the ocular surface changes. Patient management is based on how much the normal ocular appearance has changed. In general, a rating of grade 2 or less is considered within the normal limits, except the staining. And a change of 1 grade or more at follow-up visits, of course, is considered clinically significant. Conjunctival staining in contact lens users. With contact lenses lissamine green, conjunctival staining can also be useful to examine the inferior and superior regions by lifting the lipid slightly. And assigning a score to the lissamine green, staining observed can be done using the Oxford grading scale, which has a series of panels from A till E, reproducing the staining patterns met with in dry eye patients. And typically, nasal lissamine green staining is greater than temporal lissamine green staining in normal eyes. And again, I will show you the Oxford system chart with the conjunctival and corneal staining in dry eye disease cases, and or those patients who wear contacts and suffer from the dryness, because all these conditions may be present when you are screening for the dry eye disease. And namely, with this example, you may learn how to apply both an Efron grading scale and the Oxford system chart. So in this example, you could see a patient in which eye appears the 3 and 9 o'clock staining, and it often occurs as an arcuate band on the peripheral cornea between the 3 and 5, and also 7 and 9 o'clock toward the limbus. And the cornea is divided in 5 areas to obtain the staining. And you can also mark in each area when you saw the dryness, like these dots, and then you count them, and you choose it what scale is it from the letters. And to summarize all clinical diagnostic tools, I would like to show you this table one more again. And this one you could use for detect the dry eye disease. So the first two columns is saying that patient may have a dryness of the eye from contact lenses or just the dryness of the eye, but only signs. But the third and the fourth column, it's a case of the dry eye, and patient should be referred to the ophthalmologist. So this is my list of the literature, what I was using for performing for this presentation. And now I'm going to give my word to the Dr. Teresa.